Chapter 5, Medical Terminology. Some of the topics we'll be discussing today are medical terminology, the language of anatomy and physiology, which we'll be using quite often describing injuries, parts of the body, things like that, in anatomic terms. So let's start out with the components of medical terms. So compound words are made up of two or more words, such as smallpox. Then there's words made from parts, roots. Therm, meaning heat. There's roots with combining form, thermo plus meter equals thermometer. Prefixes, such as dis and tachy, dyspnea, tachypnea, and suffixes, itis, iac, like arthritis, and hemophiliac. So when we look at these examples and combine them all together, we're talking about a prefix, the root word, and a suffix. So tachy, meaning fast, cardia, meaning heart. That gets us tachycardia, a fast heart rate. Hemo, meaning blood, thorax, meaning chest, gives us a hemothorax, meaning that there's blood in the chest cavity. So when you look at these words too, as it relates to medicine, cardiologist, cardio is the prefix, logi is the root word, the study of, and ist, someone who studies the heart. So acronyms are a big thing in EMS. You'll see a ton of them. Speaking of EMS in general is an acronym, meaning Emergency Medical Services. So this is an abbreviation made up of initials that can be pronounced as a word. CPAP, meaning continuous positive airway pressure. Or you've got abbreviations, which are letters or symbols used in place of words or phrases, a lot of times just to shorten it. DNR, meaning do not resuscitate. So important thing with medical terminology, and to a point we've gotten away from a lot of complex medical terminology and gone to kind of plain talk or plain language. Don't use these terms when speaking to patients or family members. While we know what they mean, chances are they may not, and it may confuse them or concern them even more than they need to be. So just talk to them in plain language. A lot of times this can cause confusion even among trained healthcare professionals. So whenever in doubt, just use plain English. Describe where the injury is or where they're feeling signs or symptoms at. The problem with this is that there's a lot of chance for confusion and ambiguity with this. So just use your simple terms as it relates to where a lot of these things are at. So let's talk about some of the language of anatomy and physiology. Anatomy is the study of body structure, whereas physiology is the study of body function. So anatomy is structure, physiology is function. Anatomic terms. So the anatomical position is defined as a person standing who is facing forward, hands are at their sides, and their palms are facing forward. So we divide the body into planes. Midline, medial is closer to the midline, and lateral is farther away from the midline. When we talk about bilateral, we're talking about both sides. If we're talking about unilateral, we're just talking about one side. And then there's the mid-axillary line. Anterior, or ventral, is the front. Posterior, or dorsal, is the back. Think about dolphins and things like that. They've got a dorsal fin, which is on their back. Superior is vertical, or above something. Inferior is also vertical, but it's below something. Think about kind of the chain of command in a business or something like that. The CEO is superior to the newly hired employee. Proximal is going to be closer to the torso, whereas distal is farther from the torso. Palmar refers to the palm of the hand, whereas plantar refers to the sole of the foot. So here you see a diagram of the body, talking about the head, torso, and lower extremity as it outlines on the left. So the head is superior to the lower extremity, and the foot is inferior to the torso, if that's starting to make sense. So here you see on the image on the left, you've got the midline. So if you draw an imaginary line straight through and down from the middle of the head through the groin. And you see on the left too, you talk about proximal and distal on the patient's right arm. So the shoulder is proximal to the body, whereas the hand is distal to the body. And medial is close to the midline, whereas lateral is out to the side. On the other side, on the right-hand side here, you see that the body is divided into front and back. So we've got the anterior portion and the posterior portion. And this is done through the mid-axillary line. An imaginary line is basically drawn through and passes through the armpit, is your mid-axillary line. Your mid-clavicular line, it divides the chest into regions. So there's two clavicles, therefore there's two mid-clavicular lines. Here you see the different types of planes in the body. You've got the transverse plane, which basically cuts you in half just below the waist. You've got the sagittal plane, or the median plane. Think about that as your line that divides the body from top to bottom, just like midline. And you've got your frontal plane, which divides the body into front and back down the mid-axillary line. There's 4 abdominal quadrants. So imagine that there's a line drawn vertically and horizontally through the navel. So that gives you your right upper quadrant, your left upper quadrant, your right lower quadrant, and your left lower quadrant. Here you see on the image on the left that it's divided in a vertical and horizontal line through the navel. And it stops basically at the diaphragm. So housed in the right upper quadrant, you've got your liver, your right kidney, the colon, the pancreas, and the gallbladder. In your left upper quadrant, you also have the liver, but the majority of it's going to be in the right upper quadrant. You've got the spleen, the left kidney, stomach, colon, and pancreas. You'll notice that the colon goes throughout all 4 quadrants. In the right lower quadrant, you've got another portion of the right kidney. Again, the colon, your small intestines, the major artery that goes down to the right leg, your ureter, and your appendix. And then in the left lower quadrant, you've got the other half of the left kidney, again the colon, more small intestine, and your major artery and vein go into the left leg, and also a ureter. The bladder is housed in both the left and the right lower quadrant. As far as positional terms, laying supine, the patient's on their back. If they're lying prone, they're laying on their front or their stomach. And the recovery position, there's left recovery and right recovery. The patient's lying on their side, and this is a preferred method to transport or position any patient that's unconscious when we're not suspecting any sort of C-spine injury. There's a patient laying in the supine position, and the same patient laying in the prone position. And here's a patient laying in the recovery position, or the left lateral recumbent position. Semi-Fowler's position is your patient sitting up at about a 45-degree angle on the cot. Your Fowler's position, they're sitting at a 90-degree angle on the cot. Remember that medicine has a language of its own, so as an EMT you'll frequently communicate with other medical professionals who speak this language. So it's important that when we're using these terms, such as supine or prone, posterior, anterior, ventral, dorsal, whatever it may be, that we're using these correctly. So as we don't avoid, or so that we can avoid confusion rather, and not make things any more complicated than they already are. Remember that most medical terms generally consist of a root word with a prefix and/or a suffix. Medical terminology is the language of healthcare. There's roots, there's prefixes and suffixes, and they can also lead to clues that mean many different terms. So sometimes if you're not sure what the word means, you can break it down between the root word, the prefix, and the suffix and figure out what it means. Remember that understanding anatomy and physiology is just like reviewing the owner's manual for the body. We need to know a lot of anatomy and physiology as it relates to the body, so we can describe things and be able to understand what's going on with a patient. Anatomical terminology brings precision and accuracy to descriptions. That way we can more precisely define and outline what's going on with our patient. Things to consider. Is my use of medical terms accurate and descriptive? Can I identify critical organs and structures that reside in an area where a patient has a complaint or traumatic injury? This one's specifically pretty important. You guys will need to know and be quizzed over the organs as they lie in the abdominal quadrants. So we need to know that the liver mostly lies in the right upper quadrant. We also need to know that the spleen is housed in the upper left quadrant, and the appendix is in the right lower quadrant. So these are things that you'll need to know and memorize as far as what organs are in what quadrant. So you respond to a teenage boy who has taken a hard fall from his dirt bike. He has a deep gash on the outside of his left arm, halfway between the shoulder and the elbow, and another on the inside of his right arm, just above the wrist. His left leg is bent at a funny angle, about halfway between the hip and the knee. When you cut away his pant leg, you see a bone sticking out of a wound on the front side. How will you describe your patient's injuries over the radio to the hospital staff? That concludes Chapter 5, Medical Terminology.